Welcome to everyone joining us today for our first segment of our webinar series targeted for community health workers and their supervisors. As you know, community health workers can be an important component of team-based care and can help address persistent and preventable health inequities. CHW team members are uniquely equipped to build relationships that inform and empower patients with chronic illness, such as asthma, who face barriers to good health and good care related to culture, language, literacy, social, and economic factors. This webinar series, Lessons from the Field, is brought to you through a collaboration of the American Lung Association of the Upper Midwest and the Minnesota Department of Health Asthma Program. These webinars are intended to help community health workers and their supervisors recognize issues that they may encounter or see in the home setting. Our focus will be on the recognition of situations in the home that may have a negative impact on the health of a person who has asthma, and suggestions or solutions will be provided that can help improve the health and well-being of someone with asthma. Together, we encourage you to spread the word about this webinar series. Asthma is a chronic disease of the lungs that affects 25.7 million people nationwide. In the United States, 8.6% of children and 7.4% of adults have asthma. Asthma is characterized by repeated episodes of wheezing, breathlessness, chest tightness, and nighttime or early morning coughing, and symptoms of asthma can improve when triggers of asthma are reduced or eliminated in the environment. Our presenter today is Andres Flores Yerbanti. Andres will be presenting on several case studies on situations he has encountered when going into homes to respond to calls for help with children who have been diagnosed with asthma. And he will provide some solutions, education he has provided to the families to help them improve the environment for these children. Andres received his master's degree in public health administration and is currently a senior manager at the American Lung Association of Minnesota. Without further ado, I will now turn the webinar over to Andres so we can hear more about the case studies he has done. Andres?
Thank you very much, Kathy. This is Andres. Welcome all to this webinar. I'm very pleased and honored to be able to be talking to you about all my experiences working with situations in the asthma and the home environment field here in Minnesota, mostly in the Twin Cities. First one, how we're going to be doing this today, we're going to be talking about 3 different case studies developed here in the Twin Cities. One of these studies, they're all done by me. They're real cases. We just changed a little bit. We're not going to be talking about names or anything like that, but the case studies are real. A single mother of 2 calls requesting services on asthma. Both kids, 4-year-old and 7-year-old, has asthma. So what we know is that they live in an apartment, and there's a lot of garbage outside the home, and people are smoking outside. We really don't know much. A lot of times we receive a lot of referrals due to a program that we have. One of the objectives is to develop that referral system. And in order for us to do that, we do invest time to develop those and maintain those connections with clinics, with schools, with local city or county health departments, where they can refer to us some of these cases. A lot of times the schools are a really good place for them to refer. And we also have the access to do presentations. Presentations are really good tool because we have the ability to talk to parents, for example, to talk to people in the city, to talk to professionals in many lines of work. And in this case, we have an opportunity that in this case, I talked to a group of parents, and one of the parents talked to a friend who they knew that their kids have asthma. So they just told my name, and it was very, very easy when they called the American Lung Association and asked for my name and for the program. That's how I received this referral. And the apartment, when I went there, first thing I do is to look outside while I'm getting there. Where is the apartment? And this apartment, I know is near the city. So there are heavy traffic constantly. In fact, it's one of the hot spots that I call. You can revise those hot spots in MDH website, where in the city they have more cases with zip codes, have more cases of asthma being reported. You can find it in MDH. MDH.org or
.gov.
.gov, yes. And if you click on search for asthma, and they'll give you a number of information, a large number of information referrals, but at the same time, hotspots, or not hotspots, but zip codes. They have a lot of maps, and this is one. And in this case, there's a lot of garbage outside as well, meaning that the chances for rodents, or the chances for a lot of cats or cockroaches could be high. They do smoke outside, and that's a big problem that we normally see in houses. But in this case, in an apartment, it's even greater because the apartments are connected to each other. So even though they're smoking in the same apartment in their own home, the smoke goes through the other apartment, and that's a very normal complaint and concern from individuals that I go to. So that's the first thing I saw. Of course, I do look for any other things once I go in. Safety issues, for example, I talk about if they have fire extinguisher and things like that, even though that doesn't have to do with asthma, but in our program we provide that. Interview, first of all, we need to interview and do an assessment with the family. Normally it takes like half an hour, 40 minutes. And but before all that, we need an authorization sign. And after doing that, we will ask the lady, or normally our moms. In my experience, normally you'll find the mom in the house, or they take the day off or the time off just to be there, because they're more in tune with medications. Because while I'm asking questions, I ask questions about their medications. Where are they? How are they kept? What are the doses? How often they use it? And if there's any questions, I do give them that educational piece, which is perhaps the most important piece in my visit, that educational piece. The rest, yes, I looked around to see if there's some evidence of mold, for example, that is very obvious to look at. And a lot of times you will find it very obvious, and families don't even know. And sometimes they really can't do much other than just to leave the apartment, because I've seen a lot of times that owners, they're very hesitant to do anything promptly, but the kid is going to the emergency rooms very, very often. But again, not every family has the opportunity to go to the emergency, to leave their apartment as soon as possible. a lot of times because of their financial or their political status here in this country. If it is an immigrant family, it really challenge them to make the next step if they can just leave the apartment or not. So that's when it gets a little bit more complicated. So then after revising all these things, we looked at the place, but before that, I asked them if there's any concerns that the family has, and I'll address them. I will address that first of all, because that's the main reason why they want us to be there. And then after that, I look around, and most of the time I find things that the family just never thought about it. And then at the end, I come up with a remediation plan. In this case, we see I went to the room, and they're sleeping on the floor. Regardless if they have, you can see the next picture, they have a bunk bed, but they don't use it. So mom thought that having them in the same room because of concern that they won't sleep well at night. So she has them in the same room, but she has them in the floor. For us, that's a concern. That's the way the floor was. Probably you cannot really see it in there, but it was really, really dirty, and they were using carpets. What's the deal with the carpets? Well, the carpets, it attracts a lot of dust and everything that is in it. In this house, they didn't have any pets, but it's not a brand new apartment. It was not brand new carpets either. So we don't know if they have a problem with dandruff or from pets or anything like that. So at night, they put all the mattresses like this, and as you can see, they're all on the floor. The mattress, again, they're not new either. So in our program, we do provide mattress. We buy brand new mattresses. We buy brand new bed frames, box springs, and everything that has to do with the bed covers. The covers that are good for, especially to avoid the people who have asthma to get more allergies with it. The material is not like plastic. It actually has little pores that allows to breathe, and that's one of the main concerns because families, especially the moms who are taking care of their children, they're very concerned about those things. And the first thing when I said, well, I have this cover for the mattress, oh no, because my kid sweats a lot and that's why we don't use it. Well, maybe the cheap kind will do that, but not the kind that we have is not the most expensive, but it's not the cheapest either. It's the one that we normally use, and it allows the person to not to sweat. So that's one thing. So this is how we saw, and we changed that. We also looked at some spots. If you can see some spots in here and the other picture. When I walked in, I didn't react immediately, but homeowner, she had humidifiers in every single room of the house. And all the rooms, obviously, they're connected. But when you walked in, where I walked in, it was the kitchen, and she had a humidifier there. And then you go to the bedroom, she had a humidifier there. In the whole room, I mean, everywhere, she had humidifiers. And that was a concern. You can tell that the walls and the ceilings were sweating. Kind of that look with wetness all over the house. And it was because all the humidifiers are on. I'm originally from Costa Rica, and my skin really immediately felt great. But what's the concern is that all that wetness of the walls, it could turn into mold if there is no circulation, air circulation. So I was telling her, that it might be a wise idea to turn off some of your humidifiers because of that. And those spots that you see there is not actually mold, it's grease. It's grease accumulated from the kitchen. Then we'll start with the second study. Well, another thing that we talked about on the first case, we also provided vacuum cleaner with a high efficiency vacuum cleaner. And that has to do with, it has two bags, two filters. It's high efficiency in the sense that it won't spread the dust in the air. And that's one thing that is not the greatest looking. It's not a Tyson, for example, but even though it does a better job than a Tyson, by not spreading the dust. That's why it's a high efficiency vacuum cleaner. In our program, we provide those vacuum cleaners at no cost. But at the same time, I provided to the lady some cleaning supplies for her to clean a little bit the bathroom. Most of the time, it's just a little cleanup that they need. And that's the remediation plan that we provided. We provided all that, plus a fire extinguisher, just in case. And we also looked at how is it that they do laundry, if they use laundry soap or, anything like that that has to do that will help the child to get more any asthma symptoms. And for example, the laundry detergent, and the softener, anything that has a lot of chemicals that will smell may not be a good idea. The child might react to it. In the second case study, we had the opportunity, it was the local county health department. Here in the Twin Cities, a family has of 8, they live in a small trailer. And a 7-year-old child has asthma. Well, first thing, I'm driving to their house, and there's a chemical plant right next to them. That was the very, very first thing I looked. And they were placed the trailer was placed at the end of the trailer park, facing the chemical plant. Even that, for example. So is that a concern? Yes, it is a concern, because basically the chemical plant is kind of like the backyard, almost. And having so many kids, the kids will going to be playing there, and they're outside all the time. I know that for a fact that they just sold all that area, and they're looking for a different place. They're looking for a different place. So, and that's a good news. And by the good news, because it's not easy to find another place for them to live, especially because the trailer that they had is such an old trailer, and the condition, their finances are not the greatest, that they cannot just pick up and move. They know that they could not move their trailer. So, and they only gave them not very much money for where they live. So when I walked in, it's a very old trailer. They have so many kids, only 2 bedrooms. They have 2 dogs, small dogs, and a newborn who repeatedly is sick. So a mom works. Mom works in the house. So when I walked in, she had an open flame in the kitchen making tamales, for example. And why open flame? Because that's the way it tastes good. I'm not making 2 or 3 tamales, making hundreds and hundreds of tamales because Mom works for cooking and she sells food in order to support. Now, it was in the winter, so at the same time they figured out that with the heat from their cooking, they heat the whole trailer. So, and the smoke is there too because everything is closed. And 4 7-year-old keeps going to the emergency room. They can't understand why. And they call me saying, we need an air purifier. Well, I did go and I provided an air purifier, but there's a series of things that needed to be changed. And that's one of the things, a lot of times change is really challenging to do in a family, especially when there are some traditions involved. There's some cultural pieces that are involved. The fact that they have a dog or 2 dogs is not by accident, it's not because they like it. It has to do some cultural factors that they want the dog there. The fact that they have smoke in their home is not because they like it or because they just decided like that. No, it's because it's the right way of cooking it. Otherwise, they won't eat it. It just won't taste the same. There's certain things that some cultural ways of how to do things, and I have to be the one who's going to tell them this is bad for your kids' health, and not just for them, but for all of you too. And how do you do that is by just suggesting how they can do the same thing, but perhaps in a healthier way, for example, and just ask them to try, not to you have to do it and impose my will. No, just to ask them to try. So when I walked in, they live in a 2-room, Mom cooks, and they have dogs. Again, the local health representative comes in. It was a relationship with the local health that they have developed, and thanks to that we had the relationship with the local health, they refer that to us. Again, I can't say enough how important those relationships are, because if it wasn't because of them, you cannot really go into somebody else's house. That is this easy unless you develop, again, a new relationship, and that takes time. The local health department has years working with this family in other things. And when somebody had asthma or some symptoms and knew about this new program or the program, they contacted us. And it was such a much easy and fast ride for us just to go into the house and give the services needed. So we interview again, and we did the remediation plan as we did in case number 1. And in this picture, as you can see, we have a different problem. We have a problem, you probably can see here on the floor, some mouse gubbins and all over the place. And here in Minnesota, as I was telling the people, that you see a lot of mice trying to get away from the cold. And if it is a trailer that has a lot of not very secure walls, what will be a very first place to go to? Another thing that I saw in here, it was the filters. The filters, you'll be surprised, not just in this house, but you'll be surprised how many homes you will find homes that their filters, one, are not the more efficient ones due to the fact that they don't replace them. Sometimes they say, well, you need to replace them every 3 months, sometimes every 2 months, sometimes every 6 months. I always tell them, just check on them once a month to see how it is. If it stands more, sometimes you have to replace it in 2 months, or maybe in 3 months, or maybe in 6 months. But there's not really a set time when you need to replace them. Just check them, and if it needs to be replaced, just replace them. That's what I tell everybody. And the other factor here is the quality of these filters. Sometimes, especially landlords, they find the cheapest kind that you can find because financially it's good for them. But when you have a child with asthma, it's not very good for them. So in this case, I always recommend them to just make the investment. It will really will make a big difference. In our program, we provide them. We provide the filters for their homes. I normally bring 3 or 4 filters. That should be enough for a year, easy. If they need more, I'll bring more. That's not a problem. And then in the other picture, also they had mold. Mold that it's just there. And a lot of times it can be just washed, and that's about it. But normally what we do is we just don't wash it because we know it's going to come back again. So what we do is we request for them to we need to try to find out the cause of this mold. Mold, we need to have a certain things in order to have mold, and that is an organic matter. We need to have lack of circulation, of air circulation, and humidity. And in this case, I can see that most likely there's a leak in this place that needs to be fixed before we fix the wall. That's what I was telling the lady about this. I did provide something to clean it, but in this case, I recommended for them to check on the other side of the wall. That's basically that, and also this is underneath the sink. In this house, also cockroaches. It's a small place, so you see a lot of food laying around, especially when mom is cooking in such a small place, making large quantities of food. You see, I was telling them that you need to try to keep everything closed because cockroaches can come in, and especially mice. As we saw, they had mice. One time, one person said it's just regulated by the health department. No, this is just a house of immigrants who they just happen to know how to cook, and other people just on the side, hey, can you cook this for me? And she does it. Or she makes, instead of 10 tamales for her house, she makes 100. And lots of people, where they live in other trailers, they know that she cooks, so she just sells them for, I think it's like $3 for 2 tamales or something like that. So it's not really regulated on any kind. But in the case too, it was very, very good to have instrumental to have the connection with the local health department. On the case 3, parents were referred by the school nurse to have a home assessment done. They live in a 2-bedroom townhome next to 494 in Bloomington. Why am I so specific? Because I was so impressed and surprised because in the time that I've been doing this, I've never seen something like this. And I'll show you some pictures. We know that the kid has a severe case of asthma. Nobody smokes in the house. It's an apartment. And mom had to go to the ER at least 4 times in the last 4 months. This is a very recent case. When I showed up there, almost immediately I felt as like a strong smell and humid. It was in my nose. It's like something. I knew it was something going on. I just couldn't target what was it. So when I walked in, yes, it's in front of 494, but Mom was there. Everything was super, super clean. Well, you know, and I walked in and I did the interview. I did everything I normally do, and I started looking around. Sometimes people have the misperception that asthma is when you have the symptoms, but when you don't have symptoms, then you don't have asthma, and that's a concern to us because I ended up knowing that all 4 kids have asthma. Only one had a severe case of asthma. The other 3 have asthma too. So I did the assessment to all 4 kids. But it's something that you would normally see that lots of times when they don't have symptoms, asthma is gone. And they don't understand that asthma is there to stay. And they have to keep doing the treatment, take their medicine, and all that. So I walked into the house. I talked to her, looked at the surroundings, interview, and then I did the remediation plan. One of the things that I saw first and foremost was the wall because I concentrated on with the kid that was having a lot of problems. She couldn't understand why because she said that she kept everything very clean and everything. Well, so happens that they just moved the bunk bed into the living room. This is a 2-bedroom apartment. Again, it's an apartment. It's a 2-bedroom apartment, 4 kids, 2 adults, no animals. But the kid all of a sudden has been going to ER very often. So they call me and I looked around. What is it that I see? Well, you see that teddy bear in there. Teddy bear is in the bunk bed. The bunk bed is next to this wall. So happens that they just moved the bunk bed to the living room. And they thought it was the best thing to do and everything. But they didn't look at the wall that if you can see, it has duct tape. It has some duct tape on the top, but at the bottom is no duct tape. All that is mold. Everything is mold. You'll have a better view in the other picture. The next one. The bunk beds are placed in the living room. The living room is next to it. So when you walk in, you can see the living room and the bunk bed. And the wall that is full of mold is an exterior wall. And the walls are with the screen door and all that. So there's a lot of condensation, a lot of mold in there. And the kid that goes to the ER a lot sleeps there. So literally the wall was black, literally black of mold. And, well, again, the owners, the landlord wouldn't do anything to it according to what the parents said. Sometimes it's hard to verify that. And it's in the middle of the winter too. So first thing, I took pictures. I told her, okay, you cannot move from here. Okay, let's look at the rest of the house. And it's just a wall, nowhere else. It's just a wall. So I told her, well, why don't you move the bunk beds back to that bedroom because the bedroom has no mold or anything. Then I isolate that room and I put an air purifier. I brought cleaning supplies. I told her that you really, really need to move or have them fix this. And if they don't fix it, move it. Because she announced me that her lease was going to expire in March. So they were deciding to move or not, and I told them, please move, please move to a place where there's no mold. And one of the things that I've noticed is moms and parents, they find every time the things that I tell them, they're very obvious, but they feel really bad that they didn't see it before. It's so obvious. It's very, very obvious that the wall was making the kid very, very sick. And, they moved them. I also provided a vacuum cleaner because there were some places that was really, really dirty. But another thing that I noticed in this house was the vents. If you can see this vent, it's not useful. That's my hand holding the vent from the kitchen. When they cook, where is that going? Nowhere. It stays in the house. Mom did not know that could be washed. So I explained how to wash it with really hot water. And so air can actually go through. And that's very important, especially in such a small place when they have to cook and they have a kid with a extreme severe case of asthma. In a different opportunity, I have kids with severe asthma, with no ventilation, and the kid is the oldest, so likes to help or is willing to help around in the house. So he's either cooking, and it's even worse because he's getting all that oil, all that flame, everything that is there, is getting in first contact. Another thing that I've seen when mom tells me, oh, no, my kid always helps me clean the floors. And they use Sampic, they use all these aromatic chemicals because they have the understanding that when it smells good, it must be clean. It's like Clorox, Sampic, all these cleaning supplies. Another thing that I've seen a lot, and I've seen it very, very often, is when I announce that I'm coming, they put candles, they put aromatic air fresheners all over the house because either they're concerned that I might smell something, and they're proud of how the house smells and everything or how it looks. And in my case, I'm very, I tell them very often that please just leave the house as you normally have it. Don't worry. You should see my house. It's worse and things like that. Why? Because I keep telling them that if it smells good, it's because it has a lot of chemicals in it. If it has chemicals, maybe for you it's not bad, but for a person who has asthma, a kid especially, it's even worse. It's really, really, really bad. And again, there are some suggestions that are very evident. They're very obvious, common sense. And one of the things that I've seen all over the place is there's not a single parent that doesn't feel the need to do better in what they do, to learn what else can I do, because they're very, very concerned. I haven't seen anybody, I really have not seen anyone that is not concerned about the child's health. And when I come and tell them, for example, I mentioned the fact about the dogs. The dogs, they have a belief that it helps to improve their asthma conditions with the dog. And there's some evidence, there's some cultural evidence about this. So a person who believes, because of their culture, they believes that a dog will help, she brings two dogs. Yes, for somebody that probably knows about it, would say, well, this is wrong. But for somebody who believes that this is the right thing to do, what a loving, caring mom that is trying to do everything just to improve her child's health. And with that, I think it's very important to acknowledge that all those differences, acknowledge that they all want to improve their health, and we also trying to provide some advice and a lot of times and some change in behaviors, and a lot of times teachers won't carry it out. In our program, we try to be here at the same time, and we follow up 3 months in a year. And I have a few people who they call me. They just call me for questions, or just even if it hasn't been 3 months or anything like that, because they see me as a person who helped them once, and they have established some sort of a relationship. And so they call me if I can get something else, or if I know about something else. These are some of the experiences that I have in the past. I hope you liked it. I'm going to be working for the next webinar that also has to do with asthma and experiences. Once again, thank you all for this opportunity, and thank you for Minnesota Department of Health, our collaboration that allowed us to be here today and present into this matter, asthma matters. And it really, really, we need to be able to be open in those cultural differences. That's one thing that I've seen a lot in all the visits that I've done. Once again, thank you very much for your attention. And please feel free to contact us over at American Lung Association or Minnesota Department of